I'm Dr. Mustafa Gamil. I'm a periodontist. I born in Egypt and I spent my whole life in Cairo, Egypt. My private practice, I have 3 clinics and I'm starting all my way working in Egypt. I started my faculty of dentistry studying in 2005 and I finished my PDS on 2010. During these long years, we are mainly focusing on learning fillings, root canal treatment and crowns. But I don't like all this stuff. I'm more or less interested in implantology and periosurgeries. Among this period, I take a decision to go for a master's degree of periodontology in my own mother faculty, which is Faculty of Dentistry, Cairo University. And I started in 2012 after finishing my residency, going with a master's degree program, working with my master's degree thesis on the sinus lift, trying to dig into the field of sinus lifting, how to do the sinus lift, the open and closed approach. This was like the core of my scientific implantology. This has put me on the track as I can see. So from here, after finishing my master's degree, I can do sinus lifts, I can do a little bit of soft tissue grafts, crown lengthening, GTRs, but I'm not confident enough to do the full arch cases, to do a GBR, bone blocks. That's why I started taking a lot of courses in Egypt and the outside. I started trying to networking with all the big names to learn from them. And then I went back to my homeland, to Cairo, Egypt, and I started my learning training program. We have the 1-year advanced implant program. We are mainly focusing on teaching young implantologists how to do the best implant options, how to do the advanced implantology, from the surgical part to the prosthetic part, how to implement the digital up-to-date dental treatment, and to be evidence-based. Apart from being a dentist, I'm a father with 2 kids, Hussein and Layla. Hussein is 12 years old, he's a handball player. And Layla, she is a ballerina, she is 8 years old. And my wife, she is a dentist and love of my life. We are sharing the same school and the same section in Faculty of Dentistry. She is a prosthodontist and she is the head of the lab and prosthodontic in our clinics. She is struggling a lot of me to reach this step in my life. Starting my day early morning at 6 a.m. to have a chance to meet my kids before going to school and taking them to the bus where they go to the school. Then starting my day with a fresh shower and go to mosque to have my prayer, and then I read part of the Quran. Then I take my car and go to the gym. In the gym, as you know, our profession is very, very tough with a lot of stress, so we need to relieve this stress with the gym. After the gym, we have to go to the pool to relieve with the cold. Then I'm ready and fresh to start my clinical day and see my patients. While I'm in the car, I'm starting talking to my receptionist and check do the patients are ready or not, to talk with my team to prepare everything for our day. As you know, the dentist is like a family member. We are trying to build a good relationship with our patients. It's not about money, it's all about repetition, about delivering the best for your patient. Especially when we are talking about implantology, it's not a hit and run. Most of our cases may take 1 or 2 years to finish, from augmentation, soft tissue and hard tissue, temporization, scans. It's a lot of work. So if you don't have the ideal relationship, a clear relationship between you and your patient, you will suffer a lot and the stress will be much more. After that, it's very important to communicate with your team members. To improve the quality, it's not about you, it's about how you're gonna deliver, what your goals as an institution, what the goal of this, how to prepare our patients, how to prepare our schedule, how to make everything comfortable the best way for our patient. Apart from the clinical work, I'm dedicating a very large part from my life for education. We are working with the advanced implant program. We have a lot of young dentists who are aiming to learn implantology from basic to advanced. They came to us after finishing a dentist school. As you know, we are not, more or less, we're not learning implantology, just very superficial. So if you want to practice this on your own patient, you need more or less post-grad training. So from here, we're starting making an impact to the community and the society by improving the quality of the graduates, by improving how they can do implant, not only the basic cases, but also the advanced in an evidence-based protocol, working on patient from the analog workflow to the digital workflow. This is the purpose from life. And if you have this aim clear, you can see it with your eyes, you have a reason to wake up every day. A very good question, why dentistry? Why you specifically choose to go for Faculty of Dentistry? After finishing my high school, I was nerd. I have the highest on my class, and I can go whenever I want, to go for medicine, to go for pharmacy. But for me, the Faculty of Dentistry like the best for me, especially because I found that Faculty of Dentistry is like combining not only medicine, but medicine and artist. I love the hand skills, and I was good in drawing. That's why maybe this is the reason why I choose Faculty of Dentistry. In 2010, after finishing my PDS, I'm trying to take a decision to go for endodontist, to go for ortho, to go for surgery. And at that timeline, as you know, there is no a specific branch for implantology. So if you want to learn implantology, it's either going for a surgery, pure surgery, or going for a prosthodontics or a perio. So I'm always looking for aesthetics, how to deliver the pink and white aesthetics, and can be achieved with a perio. And at the same time, the periodontist in my faculty, they are the best to do implantology. That's why I went for a perio department, and I started my master's degree, which I have finished in 2015. Regarding Megamind, from where did I know about Megamind? For me, it's a brilliant idea. So you are connecting young implantologists to share their own cases together. It's not only about selling implants, it's about improving the quality of not only a dentist, but also a speaker. So Megamind, they are creating a future speakers. So the idea was brilliant. I know about it from Dr. Ahmed, the distributor of Megagen implants in Cairo, Egypt. He introduced to me the website and the YouTube channel, how they work, and the previous doctors who already success to be a representative for Megamind. Why did I apply for Megamind? I found that it's a great opportunity to network with doctors from all over the world, to have a better exposure for new techniques and new doctors, how they are delivering and how they are treating their patient, to learn from each other and sharing knowledge together. Regarding Megamind 2026 taking place in Toronto, Canada, for me, I never visit Canada, so it's a good reason to attend there. But also it's a very prestigious event to share among all these world-class speakers. I would love to share them, and I'm looking forward to be the winner. It's not easy, of course, but I will do my best. After years and years of implantology and perio, I have found that I have the correct decision. I'm happy of what I'm doing every day. I'm pleased and satisfied by the smiles we are drawing on our patient face, how we are changing their own life, the quality of life. They can smile again, especially with the cases with completely edentulous. They cannot speak, they cannot talk, and they cannot communicate. We improve. So dentistry is nothing small. It's huge. It affects the life of our patient dramatically.